Can gastroenterologists detect ulcers during a colonoscopy? Have you ever wondered if gastroenterologists can spot ulcers during a colonoscopy? The answer is yes, but it comes with some important details. A colonoscopy is an endoscopic procedure that lets doctors look directly at the inner lining of the colon and the terminal ileum, which is the last part of the small intestine. This procedure is mainly used to find issues like inflammation, ulcers, polyps, and tumors in these areas. Gastroenterologists can indeed detect certain types of ulcers during a colonoscopy. For example, if someone has inflammatory bowel diseases such as Crohn's disease or ulcerative colitis, colonoscopy can reveal various types of ulcers. In Crohn's disease, you might see small, shallow ulcers known as aphthous ulcers, as well as deeper and more complex ulcers. There are also unique patterns like serpiginous ulcers and cobblestoning of the mucosa that can be observed. In cases of ulcerative colitis, the colonoscopy typically shows widespread inflammation and superficial ulcerations. However, it is crucial to note that colonoscopy has its limits. It cannot detect ulcers located in the stomach or duodenum, which are the common sites for peptic ulcers. These types of ulcers are usually diagnosed through a different procedure called upper endoscopy or esophagogastroduodenoscopy. This procedure examines the esophagus, stomach, and duodenum, which are not visible during a colonoscopy. To summarize, while colonoscopy is effective for identifying ulcers in the colon and terminal ileum, it does not visualize peptic ulcers in the upper gastrointestinal tract. If someone is suspected of having peptic ulcer disease, the appropriate diagnostic tool would be an upper endoscopy. On the other hand, colonoscopy is excellent for evaluating ulcers related to inflammatory bowel diseases or other issues within the colon. In conclusion, gastroenterologists use colonoscopy to find ulcers within the colon and terminal ileum, but not for peptic ulcers in the stomach or duodenum. If you have concerns about ulcers or gastrointestinal health, it's always best to consult with a healthcare professional for personalized advice.